gentlemen, and welcome to a special edition of our Kidney Care Talk Show, which is presented by IHW Council in collaboration with RG Hospitals. I'm your host, Dr. Behjat, and today we'll be discussing about kidney stones, understanding symptoms, causes, types, and treatment. We'll be discussing about when and how to treat kidney stones. And to discuss about this very pertinent health issue, I have with me Dr. Sarang Kanekar, who's a consultant urology at RG Hospital, Goa. Welcome to the discussion, sir.
Thank you.
So coming to the first, most basic question, when we talk about kidney stones, what are the symptoms that a patient might have before he comes to the conclusion that he might be having kidney stones?
So all depends on the size of the kidney stones and the location of the kidney stone. If it is a small stone which is in kidney, that is harboring a kidney stone. If the same stone drops to the kidney, it causes the excruciating pain. So the person will have to run to the hospital. It will also to bleeding or noticing blood infection. Suppose the stone falls down into the urinary bladder, it can obstruct the flow of the urine and the urine will get blocked. So it can range from no symptoms or to excruciating pain and severe emergency where the urine can get blocked.
Right, Dr. Sarang. So when we talk about kidney stone, what are the basic tests that a person goes to help him detect that where the stone is, what is the type of stone, what is the basic test that they underwent?
See, if a person experiences any of these symptoms which I have mentioned, it can be a simple pain, back pain, lower abdominal pain, or if they notice some discomfort while passing urine, or if they notice blood in urine, do some test, blood test, urine test, if required an ultrasound scan and X-ray. Depending upon the findings in this test, then only a specialized test like a CT scan will be required. With all these tests put together, we can come to know whether there is presence of a kidney stone, what is the size, and what is the location of the stone.
When we talk about the types, because we have already talked about how being the place at which the stone is present is also important for that matter. So when we talk about what are the different types of kidney stones, because there are a lot of myths associated. People are like, ye nahi khana, isse ho jata hai wo. So to set the record straight, what are the types of stone and how, what are the risk factors, your lifestyle, eating habits, if you could answer about that.
Depending upon the location, we can say that depending upon the chemical composition, the most common stone is a calcium oxalate stone. There are also uric acid stone, triple phosphate stone, and cysteine stones. Now, like I said, since the most common stone is calcium oxalate, formation of kidney stones is dependent on multiple factors. And the most important factor is the diet. If there is decreased water intake, or if the person gets dehydrated, or if there is excessive consumption of protein like fish, chicken, meat, then all this can give rise to kidney stone formation. To give you a simple example, if we mix a spoon of salt or sugar in a glass of water, it gets dissolved. But if we keep on adding salt and sugar, at a certain point, it will stop dissolving. So because of our dietary habits, poor water like sodium, calcium, oxygen, which are called as crystals. And crystals then grow on to become big stone.
Right, Dr. Sarang. Coming to the treatment options, when we talk about what are the treatment options now that 15, 20 years back, surgical, an open surgery was the only option, but now things have changed. So what about the treatment modalities? What are the most, frequently used treatment options when we talk about kidneys?
So the treatment options depends upon how the kidney stones present itself. Now, many of our patients come to know about a kidney stone on a health checkup. Depending upon the size and the location, the treatment modalities differ. Now, to convey 7 to 8 millimeter, which is there in the kidney, patient doesn't get any pain. There is no infection. The kidney try medical line of medicines like citrates, which helps to alkalize the urine. We also sometimes give soda bicarb, which again makes the urine alkaline and helps to dissolve small stones. Along with this, very important is to follow a strict diet. Now, when it comes to diet, they have to maintain a water intake of 2 to 3 liters per day, restrict the intake of salt in their diet, and foods containing high sodium like soya sauce, papad, pickle, which all of us are very fond of. The intake of animal protein like meat, shellfish, mutton has to be restricted. A glass of milk better. Or if the stone is blocking the kidney and giving rise to pain, difficulty passing urine, or bleeding in urine, then only we advise surgical intervention.
Right, Dr. Sarang. Coming to the treatment modalities, when we talk about new or innovative treatment approaches, like we talk about laser treatment, then there are also a lot of misconceptions that people have that laser might, harm your kidneys and there might be a problem. So please enlighten us on that.
Delay that treatment because I've been told that if you undergo laser intervention, you will have permanent damage to your kidney. It is completely a false statement. The present era of technology, we have the best lasers available, which are totally harmless. So, when a stone is blocking the kidney, or if it is big in size, more than 1 centimeter, we can use the latest laser technology and treat it without any incision on the body. So, it is a totally stitchless surgery. These lasers, what we have, they come of different power, different strength. They can break any stone which is formed in the human body without causing any damage to the kidney, to the tubes, or to the surrounding structures. So I would appeal to everybody through your forum that people shouldn't be scared that laser will harm them in future, and they should always consider getting their stones treated.
From this myth that laser may harm your kidneys, in your practice, what are some of the myths and misconceptions that you have seen people believing? Because through this forum, we can help clear those misconceptions. So, what are the five most, discussed myths that you have seen as far as kidney stone is concerned?
See, number one, one is like we discussed that lasers can harm the kidneys or can cause permanent damage. Number two, whenever we say that we'll have to break the stone and put a stent temporarily to unblock the kidney, they get scared because they've been told, that patients have been told by their relatives and known people that if you put a stent and your life will be difficult, you will have a lot of pain. So I want to enlighten people that a stent is a small tube. The reason that we put it is so that the kidneys get rest, the pressures in the kidneys remain low, and the chances of infection go away. The duration for which we keep the stent may vary from maybe 7 to 10 days to 3 to 4 weeks. Beyond 4 weeks, we never leave a stent because that itself can give rise to stone formation. Number three, when we advise them after treatment of kidney stones that they have to follow diet, they do it for a month or so, and then they go back to their original diet. They eat a lot of fish, a lot of chicken. They forget to drink water. Now, everybody should understand that once you form kidney stones, there's a 50% chance that you'll form kidney stones all over again. The only way to prevent this recurrence is by maintaining a diet lifelong and hydrating oneself properly, depending upon the physical activity. Somebody who is sitting in the air conditioned room doing office work, a person who is always outdoors working very hard in the hot sun, getting dehydrated, has to maintain water intake of 3 to 3.5 liters. Now, this next myth, which I keep getting asked in many forums and many meetings, is drinking beer helpful? Now, for some reason, somebody must have had beer and his or her stone must have passed out. And since then, they have promoted that beer helps in kidney stones. So I want to make it very clear that drinking beer is not helpful for kidney stones. Why? High content selected uric acid, beer and alcohol are very toxic and harmful to our liver. Now, there is always a notion among people that laser intervention is not good and you should try other medications. Now, other systems of medicines like Ayurveda, homeopathy, Unani are very effective. People can always try it, but they should always go to a qualified doctor who practices this science and get themselves treated. They shouldn't be using medications just by hearsay or which is promoted on non-medical, like on a WhatsApp page or on a YouTube video. Medication on the yourself checked, take the advice of a qualified medical practitioner, which can be of any science, any branch, and then only get yourself treated.
Sarang, coming to asymptomatic patients, because there are patients who do not have pain as such and they think that since it is not painful, they should not get it removed. So how can that stone have an impact on their kidneys? What is the harm if they do not get medical attention?
Excellent question. Now, like you said, many a times you also get asked that, doctor, I am not having any pain, so why should I treat it? Now, we have to understand that the kidneys are like filters of our body. They regulate the levels of water, salts. They also flush out all the toxins from our body. Now, for their optimum functioning, they should have an unobstructed flow of urine. Whenever there is formation of kidney stones at the microscopic level, there is blockage to the kidney. And a big stone can also block the kidney. Whenever the kidney is blocked, it affects the function. The kidney is at risk of damage, as well as there is risk of infection. And if a stone remains for a long time, let's say maybe 15, 20, 30 years, there is always risk of developing cancers of the kidney. There's some form of treatment for asymptomatic or a kidney stone which is silent, because eventually it is going to give rise to problems, which, like I discussed, may be kidney infection, kidney damage, or in long run, cancers of the kidney.
Right, Dr. Sarang. Coming to, since you've already talked about how protein-rich diet is, can give rise to problems, but what are some of the specific foods that people who already have a history of kidney stones, apart from protein-rich diet, what are some other things? Because I've heard that iron-rich diet, having spinach and things like that, too much of vegetables can also harm. So, what according to you are some of the foods, apart from, of course we have talked about animal fat and proteins, apart from that, for vegetarians if we talk about?
That's a very important question which you have asked now. Other than animals, oxalate containing foods. Now, with regards to oxalate rich foods like spinach, palak, bhindi, lady finger, then nuts, badam, pista, cashew, mungfali, all these things have to be had in moderation. Now, a person who is fond of fish, chicken, to become vegetarian, but it should be in moderation. Let's say if maybe two pieces is okay, but in moderation. Shellfish has to be avoided. With regards to, there is a notion that if you have vegetables with seeds like potatoes, brinjal, that can give stone formation. But there is no scientific evidence to this. No doubt, people shouldn't consume kilos of tomatoes and kilos of brinjal because diet is always helpful with regards to having a healthy life.
Coming to people who already have kidney stone and they have this history of recurring, what would be 5 tips if you had to give them 5 tips or lifestyle interventions that will help them in not going through the same thing again? So what would be your 5 tips for them to avoid kidney stones in future?
So, a person who has had kidney stones, number one, really have a good water intake of 2 to 3 liters. Two, follow the diet as far as possible. Number three, exercise. Now, how does exercise help? The body weight is in check. The levels of uric is under control in the body. Sound scan of the abdomen that will pick up if any stones have been reformed. And a small stone is always easier to treat. And like I said, give a rough judgment. Whenever they go to pass urine, the urine should be clear, just like water. If it is yellowish or slightly reddish, then they should increase their water intake by a glass or two, which will help them to maintain adequate level of hydration.
So, Dr. Sarang, coming back to when we talk about, medical management of kidney stones, any new innovative therapies that you feel, of course, we have talked about laser treatment, but anything that you feel in the coming, times we will revolutionize how kidney stones are treated. So, what would that be?
There is a lot of advancement which is happening in the treatment of kidney stones. Number one, we should have medications which will decrease the rate of recurrence of kidney stones. So many people who have kidney stones will benefit from it. Number two, the instrumentation and the laser is becoming minimally invasive. Now, like the way you said previously, maybe 15, 20 years back, the only option was open surgery. Now, the shortcomings of open surgery was that the recovery period was almost like 6 to 8 weeks on an average. There was a lot of pain, there were stitches involved. Now, I can proudly say that our fraternity can easily manage even a 5 centimeter stone with a small division of less than 5 millimeters. And there are also instrumentation available where the incision is so small that you don't even need a stitch. It is just like a needle puncture. In that, specialized instruments are used, which are very fine. At regular special telescope is used. And then with the uses of laser, even 1.5 to 2 centimeter stone can be easily treated. Also, a big stone in the bladder, the urinary bladder, be treated with minimally invasive surgery. Advancement in imaging technology, like the CT scan. The CT scan which are presently available has very low dose of radiation. There's always a concern in stone patients who have recurrent stones that so many CT scan I might develop cancer. So I want to inform them that the present machines has very low dose radiation, which can help to have a better image and also elevate the risk of developing cancers in the future.
Dr. Sarang, when we talk about, like you talked about how there is a misconception amongst people that having beer is can, and nowadays we see younger people getting kidney stones. So do you think there is this modern lifestyle which is in a way responsible for these episodes, and in younger people we are seeing a rise in kidney stones?
So what is happening is presently, like you pointed out, because of the lifestyle and especially with the younger generation, the intake of water is very low, very poor, I would say. But if you give them an option of having a, a small bottle or maybe half a liter of soft drink, they will be very happy to have that. Now, what happens is because of the sugar content, they feel nice. What I would suggest is instead of having a soft drink or a beverage, you can always go for a freshly made fruit juice. The sugar content or the sweetness of the fruit juice will give you this. Plus, it has got beneficial effects on the health also. Activity, physical activity is lacking presently. All of us are hooked onto social media or onto mobile and other screens, but there is no physical activity. Exposure to sun is also very important because only when we get exposed to sun do we synthesize vitamin D. And vitamin D is very important to maintain the levels of calcium. As we all know, most common stone is calcium oxalate. So if the calcium levels are maintained properly, then the incidence of go down. And they should have and
Think there is some issue with your connection, Dr. Saran. We can't hear you properly.
am I audible?
Yes, yes. Now you are audible. Maybe you can try switching off your camera and your voice would be clearer.
Okay, is it not clear now?
Yeah, now it is better.
Okay, yeah, proceed.
Yeah. So yes, you've pointed out about how exposure to sun is very important. Any other point that you feel that during the course of the conversation we have not touched upon and you would like to give it as a takeaway message to our audience, what would that be?
So, if I have to sum up the today's talk, I would suggest that everybody should get a health checkup done yearly basis after the age of 35. In this health checkup, there should be blood. You take it. You will be surprised to know that a person who has got kidney stones should do an ultrasound every 6 monthly. Because if a small stone has formed, that can be treated easily by medications. A big stone requires intervention.